And in the essence of time, we're going to go ahead and get started. So I'm Shannon Decker. I'm the Executive Director and co-founder of the Speedy Foundation. This morning's coffee talk is all about teen mental health first aid and overview. You're always welcome to reach out to me. My email is there, shannon@thespeedyfoundation.org. And I'm anticipating this training, this isn't a training, that this overview is going to take about 30 minutes. We're going to use part of the Teen Mental Health First Aid deck. Primarily, we're just going to walk through exactly what this is because it is different than youth mental health first aid or adult mental health first aid. So Teen Mental Health First Aid is a relatively new program. It comes from the National Council for Behavioral Health. And the idea is to bring it to our young people. It's not about young people, it's for young people. This webinar is being recorded. You are in listen-only mode. You can type your questions in the Q&A. There is a chat feature, but I'm not going to be able to monitor that. So if you have a question, let's put that in Q&A. And we will try to get to as many questions as possible. I have a survey at the end that should pop up. It's not the National Council survey, but would love your feedback. So if you were on the coffee talk where we talked about Hope Squad programming, this will look familiar. But Teen Mental Health First Aid is going to fit into a MTSS system or an RTI system. And it focuses on those social emotional learning skills. So the CEL curriculum and instruction is part of it. If you are trying to stand up social emotional learning at your school, Teen Mental Health First Aid is going to fit. If we're looking at the MTSS system or an RTI system, Teen Mental Health First Aid is intended to be given to a high school grade level. So it's going to be a universal piece. Hope Squad would have been a tier 2, a selective piece, but Teen Mental Health First Aid is a tier 1. It's going to be given to the whole grade level. The same way that programs like Know the Signs in the health class or Signs of Suicide is applied to the whole 8th grade. They're all given the screeners, they're all given the instruction at the same time. So that's where this would fit into your planning, your response planning. So some of the questions we're going to talk about: why Teen Mental Health First Aid? What is it about the pilot programs? Some of the requirements for implementing the program, how to apply, and we'll see how far we get. So 1 in 5 teens in the United States will experience a mental health challenge by the time they are 18. That's a pretty profound why. And yet there's not enough young people with mental health challenges that seek help. In a study done in Australia, the United Kingdom, 35% did not seek help. Teenagers who were struggling. In the United States, it's 64% who did not. When we're talking about young people, who do they prefer to talk to? Who are they going to go to for help in the United States? In the United States, teens go to a parent and to a friend pretty equally. And so we want to make sure that that friend isn't the last stop, that young people who are being consulted go on to tell a trusted adult. And we can train everyone to do that. So what is Teen Mental Health First Aid? In the follow-up, I can send out this flyer, or you can find it on our website, just the one-pager of exactly what it is. Teen Mental Health First Aid has a couple learning objectives. Recognize the signs of a developing mental health or substance use challenge. Recognize the signs of a mental health or substance use crisis, particularly suicide, and get a responsible and trusted adult to take over as necessary. So these are a lot of the same objectives that we have in other programs. The great part about this is that it's given to the entire grade level. So these are the objectives that we want teens walking out the door with. We want them going to college with these skills. We want them going into the workforce with these skills and raising families. And this is that early intervention piece. We talk about how, you know, the signs and symptoms of an emerging mental health condition arrive in adolescent years. into the teenage and young adult years, and that there just is no education for this. So the audience, high school students, grades 10 to 12. So ninth grade is not able to participate. We want students ages 15 to 18. The structure, you can do either way. You can do 3 sessions of 90 minutes each, or you can do 6 sessions of 45 minutes each. But we don't want this to be on consecutive days. It's not like you block out a whole week to do this. You want time in between to process. And the location is it needs to be inside of an actual organization. It's unlike mental health first aid or youth mental health first aid, where you could just have community trainings that are set up. This needs to be within a school or a district, maybe an organization that's partnering with a school, or youth serving organization or community site. So if a church has a really active youth group, that might be one. Some organizations that are structured to serve young people. Things like maybe a Boys and Girls Club or Girl Scouts, if we've got a group in the older years. Maybe an FMLA program. I know that they've been really active with suicide. That might be another good contender. So the teen action plan is different from the adult action plan. The adult action plan is ALGEE, A-L-G-E-E. And the teen action plan is different. The emphasis is on getting help from a trusted adult, how to get a trusted adult to step in. So we want to look for the warning signs. We want to ask how they are. We want to listen. We want to help connect them to an adult. And then how do we continue that friendship? Your friendship is important. There are so many different programs out there, and it really depends on what you're looking for. But the key is to be aware of what the warning signs are, whether it's QPR or something else. You know, we're training the same skills. Look for the warning signs, start the conversation, ask the question. How can we start the question? Because it can be an uncomfortable and awkward one. I think that this program pairs really nicely with the Seize the Awkward campaign from AFSP and the National Ad Council. Listen, help, and then your friendship. So it's very different from ALGEE. Teen mental health first aid online. So because this was rolling out as we are having the COVID pandemic, there's a lot of stuff that's going on. And so the National Council is working to provide this training online on an online platform. But the intent of the curriculum is to be given to students live. They're going to be talking about mental health and mental health challenges. Mental health is not a detriment. Everybody has mental health. So that whole spectrum. The impact of mental health challenges, professionals who can help, your role as a teen mental health first aider, learning the new action plan, using the action plan to help a friend in crisis, which is very different than just supporting friends that have an emerging mental health condition, or living with a family member who has a mental health condition, using the action plan to help a friend experiencing the health challenge, and then the school, community, and national resources. That's really important. You know, bringing in folks from the community who are the actual resources, knowing the faces and the names of those who are actually embedded in the school, and physically, like, where do you go? How do you navigate that situation? So there's been 2 evaluations, including 1 randomized control for the Australian Teen Mental Health First Aid Program. And the results show that there was a demonstrated increased mental health literacy, which is the overarching goal of mental health first aid, all programs, that there were more confident, that the students were more confident helping a peer with a mental health problem, and that they viewed help-seeking behavior that they viewed help-seeking from a mental health professional more positively. They also reported less psychological distress after education. So the pilot was born. There was a great partnership with the Born This Way Foundation, which is Lady Gaga's foundation, in 2018. They were piloting programs in 8 sites between 2018 and 2019. And then it expanded. And I know that I sent out a bunch of information that there was an application that was open, and the Terry Riley Health System in Idaho applied and set up the pilot program at one Nampa school. And unfortunately, COVID struck right as things were starting to pick up with that program. And so COVID's really just thrown a wrench into a lot that was going on. But I'm hoping that they are still in it to win it and ready to launch this program again next year. They're looking at the research. So Johns Hopkins University has the Bloomberg School of Public Health, who has been doing the evaluation piece. The pilot study is measuring adolescents' knowledge and general warning signs that a mental illness may be developing, the skills and confidence in providing mental health first aid to a peer, the actual usage of teen mental health first aid with peers 6 months after the training, and then the preliminary data so far has been really positive, like we saw in that overview just a slide back. So here is a little feedback from some of the schools that are administering the program.
Mental health is the importance of keeping yourself mentally stable. A lot of the stuff we learned in teen mental health first aid was techniques and things you can look for to see if someone's having problems in their life, issues. You really just learned how to identify those problems, what to do, and how to get them the help they need.
Mental health to me means everything. I think that it's the foundation of your overall health. I think that if your mental health is not okay, then the rest of you isn't. I want my mental health to be okay in order for me to be okay.
I think it's a big problem that we need to educate younger people about, because you're never going to know when you're coming upon a situation where you need to help someone who has a mental health illness.
As a friend and as a person, you need to make sure that everyone is feeling okay. You need to comfort others and be there to be their support system. That's what my favorite part about it was, that I helped someone. This experience really did make a difference in someone's life. And that's what this is all about.
It kind of opens your eyes to realize that you're not alone with these problems, and realizing that there are people that do have the same problems you can relate to, you can talk to, you can ask for help.
Mental health is everyone's responsibility, I think, to watch over themselves and each other. Everyone's going through something that you have no idea about. So just be cautious and be sensitive and be kind.
It's really been beneficial and affirming, to know that you don't need the perfect thing to say to someone to help them out. Just be there for them.
It's definitely not an illness. You can't decide if you get it. It can happen to anybody. It's helpful to know that it'll get better.
We all know somebody who's struggling with mental illness, whether we or they know it. And I think teen mental health first aid gives young people the permission to pay attention to their friends and to ask them if they need help. We have an opportunity to change culture in schools and in communities, and teen mental health first aid will be our means of doing that.
The National Council is so thrilled to be able to bring teen version of mental health first aid to the United States. We know just from these 8 initial pilots that it's literally already saving lives.
All right. So that's just firsthand. And I'm not sure if you noticed in there, but they were doing a project with Find Your Anchor. And my good friend Allie is the founder of that program. And the Speedy Foundation is proud to partner with Find Your Anchor to bring boxes to communities across Idaho and Utah. All right, so the initial pilot had those 8 sites with promising results, and so it expanded. Before teen mental health first aid, 16% were definitely willing to ask a peer if they were thinking about suicide, and 42% were definitely willing following teen mental health first aid. Students were also more likely to encourage their peers to speak with an adult about their situation. Again, before teen mental health first aid, about 37% responded that they would encourage their peer, and after, it was 65% responded that they would encourage. Students were also more likely to tell an adult that they're worried about their friend before mental health first aid. 35% responded they would definitely tell an adult. After teen mental health first aid, it was 54% responded. So that trust building between our eyes and ears of the youth population. 91% of students would recommend teen mental health first aid to a friend, and 100% of the instructors said that teen mental health materials will positively impact their students. So let's look at some of the logistics. To become a teen mental health first aid implementing site, again, it cannot be just the Speedy Foundation is going to offer this, which is different than mental health first aid. It has to be a school or maybe a school district, a series of schools that come together. There needs to be an organization partnering with the school. Perhaps it'll be a youth serving organization or a community site serving youth. Individual instructors are not eligible. Certify the following. So 10% of the adult staff at the training location must be trained in youth mental health first aid. So a couple years back, when the Speedy Foundation went into various schools throughout Region 4, and you had, large percentages of your staff trained in youth mental health first aid, you're already there. And again, this would be a piece where the Speedy Foundation could help. We could offer that youth mental health first aid to get your staff trained at 10% or higher. Again, 9th grade is not permitted, but the program has to agree to teach an entire grade level, 10th, 11th, or 12th, the entire group. And so thinking about how to scale that, if it's put into an English class or a health class, or maybe a advisory period, if you're able to flex the times there, that would be really big. You need to agree to teach the entire group of students in the setting. So we're not taking this out of a setting. It can't be done, off-site. We want it to be part of the normal culture of the group. We need to ensure student safety. We need to have protocols in place in case students do become distressed. We need to have a mental health professional available to see students if they need to be seen while the course is being taught. There always needs to be 2 adults in the room while the course is being taught. It doesn't necessarily have to be another instructor. And we must distribute an exit ticket to the students at the end of the session. It's going to ask how they're feeling and if they need to be checked in on. So in order for the adults, the instructor, or whoever the support group is to be able to go through those, we want to make sure that we're not doing this at the very end of the day. The bell rings, the kids leave, and then you're stuck there with the exit tickets. Try to get it done earlier in the day so that if we need to meet with someone who expresses that they are struggling, that we're able to do that. Application. So at the time of this presentation, when it was given to us, it was not live. And so I'm not sure if the dates are accurate. I checked the site and I didn't see anything up. But anyways, a site administrator will apply for the program. The site administrator enters this, a site coordinator. So the administrator doesn't necessarily need to be the person who is hosting any of these trainings. They're going to manage all of the instructors. If we're thinking of a district, we're going to have a lot of people here. If we're thinking of a smaller agency, there would be fewer. And they manage and enter the courses into the system. So here's some of the rules and regs of everybody's responsibilities. Site coordinator, the instructor candidates, they're going to submit an application to attend a 3-day teen instructor training. And again, as COVID was coming on, we were looking at doing this online, only for COVID. Outside of that, best practice is to do these in person. So at a glance, what it would look like for the instructor to go to training. And again, they needed to have attended youth mental health first aid previous to attending teen mental health first aid. So they need to have watched the instructional videos, completed the prep workbook and roll call meeting. Day 1, pretty broken down right there. Day 2, day 3 is when you're going to do your teaching and get your feedback. Similar to a 3-day adult or youth mental health first aid training. You're going to receive your portfolio and your flash drive with all the materials, the PowerPoint presentation, the teaching notes, 1 copy of a student manual, and an implementation kit. The teaching notes to download would be available for free. You'd get a copy of the exit tickets and then regular virtual office hours. So tuition fee for teen mental health first aid instructor training is going to be $3,200 unless you're a member of the National Council, which would be $3,000. And if you are interested in this program and you're in Idaho or Utah, well, Idaho or Salt Lake County, know that Optum is a member of the National Council, and they have worked with the Speedy Foundation in the past to, well, I would say Optum Salt Lake County has worked with us in the past to allow us to use their National Council discount. There is, and I think Optum Idaho would be open to supporting this. There's the 3-day hosted training for up to 20 participants. So if you wanted to bring the training to your site, it would be $45,000. And then the student manuals. So each manual is $895. The application was supposed to open in May. I didn't see that happen, but maybe I missed it. You can always go to Mental Health First Aid and check out their website. All of the information will be there. You can also reach out to Mental Health First Aid at the National Council. Algee, A-L-G-E-E, at thenationalcouncil.org is another email that questions get answered quite quickly at that email. So program is important. The reason that you're listening to this is that mental health first aid has impacted you, or you're looking for some mental health curriculum to embed. And we know that if we can start with young people, that we can change the culture. So if you are interested in learning more, I'm happy to talk with you, or you can reach out to the National Council. And if you see a way for the Speedy Foundation to help, whether it is through a youth mental health first aid program or sponsorship or support letters, we do believe in teen mental health first aid. We know that working with the National Council can be very expensive and it can be difficult. So if fundraising is an issue, we'd love to talk to you about that. Or if you're frustrated and you're coming up against a roadblock, feel free to reach out, because we hit roadblocks with them all the time and we can help you figure out how to navigate that. So that's all I have for you guys today. I thank you for your interest, and reach out if you have any questions. Have a good day.